awesome speech. And we're so excited for today because we're going to have even more awesome speakers. And we have this awesome person right here. Another round of applause for him.
Yeah.
All right. So next up, we have Dr. Scott Harrington. I'm not good with names. Dr. Scott Harrington from Vegan Primary Care. And we're just so excited to have him up here. Right, Vegian?
Yeah.
All right. So, aside, Vegian, you want to hear a joke?
Yes.
All right. Knock, knock.
Who's there?
Yada.
Yada who?
Yada be vegan. All right. So next up, we have Dr. Scott Harrington from Vegan Primary Care, and we hope you enjoy his speech.
Hello, testing. This is what I look like without my mask on. I'm glad that I'm following a vegan activist talk because, everybody in the world is not vegan yet. Because, every doctor is not vegan yet. But we've got the science, we've got the ethics, we've got all the reasons to be vegan. So people need to hear the message. So I thank you so much for the message. It's on point. And so I've been a doctor for over 15 years as a family doctor. I do primary care. I've been in the military. I've been deployed, and I've been doing telemedicine for the last couple of years for work-life balance. And then when COVID happened, I thought, oh my gosh, everyone's doing telemedicine. People are accepting it. I'm going to start my own telemedicine practice with my favorite group, which is vegans. So I'm not going to open up drscottharrington.com. I'm going to open up veganprimarycare.com because that's my primary message to all my patients. So, it's 100% online, although we are opening up, and there'll be more on that. There's no commute. It's super easy. It's just the comfort of your own home. No waiting rooms, no traffic, no stress. You get an electronic medical record. You can include old lab work and stuff and records that you need. I can refer you. I can order labs, all that sort of thing, just like primary care. There are a few limitations. It's hard to do certain exams, although nowadays we're getting new technologies. There's something called the Nitrate Care device. So people can purchase this device and they can do a heart exam, lung exam, and upload it. But that's not necessary. Most of the time when people see me, we talk about their medical problems, and we can get them set up with preventative care, labs, testing, referrals, and that sort of thing. So that's a shameless plug for Vegan Primary Care. And so, but what am I here to talk about today? Let's see if we can get it to... maybe I was pressing the wrong? Here, see what you think. We had to turn it on, folks. Anyway, thank you guys for being here and braving the heat. Definitely wanted to be outdoors, so it's safer with COVID. I know COVID's getting a little better. Things are moving in the right direction. Folks are getting their vaccination. That's very good. And all right. So who here has had a telemedicine visit yet so far during COVID? Okay. All right. Was it easy or was it hard? Easy? All right. I joke around. That's where the front is. I don't take a taxi anymore. I take an Uber. Because now it's too much of a pain to call a taxi. You don't know when they're going to show up. With Uber, you see them coming on your phone. And so the technology's progressed. I'm never going to call a taxi again. I'm only going to do that. So I kind of feel like telemedicine sells itself. Once you do it one time, you're like, wow, this is way easier than having to wait and being in the comfort of your own home. So let me introduce two special vegans we have here today. We have Cash Harrington and Gwyneth Harrington.
Hi.
Those are my children. So, how about, does anybody have any questions while we're waiting to get the talk set up?
Well, I see on your website you are in the process of getting more insurance companies.
Yes.
And what is like the process to maybe even encourage our insurance companies to partner up with you?
Several of my patients have tried to reach out to insurance. We have a gentleman here who's tried to reach out to his insurance. My intent when opening up a practice was to have a completely insurance-based platform so that, there wouldn't be barriers to people being seen. Right now, I have Cigna, and I have TRICARE, and I had Medicare, but there's more paperwork needs to be ordered, so I'm going back and forth with Medicare. But we're waiting on Aetna, we're waiting on Florida Blue and United, and right now, if people do not have that, we see patients on a cash basis, so it's $150 for an hour visit or $75 for a 30-minute visit. And so once you get into the system, just like your primary care doctor, we have your chart, and you can send me messages, like if something new pops up or you need a refill on medications, and that can all be done without a visit, or I do a phone call or something like that. So to your question, you can reach out, but they would just kind of point it back to you usually and say, well, tell them to put out the paperwork. So, so that's kind of problematic.
Is there an age period that you see primary, or do you see all the way down to the youngest,
Yeah, so family medicine is cradle, is all the way from, 0 to 100, so to speak, all ages. But ever since COVID happened, pharmacies have been allowed to do vaccinations on children up to under 3 years old, but under 3, you have to go to a pediatrician to get your vaccinations. So I tell people, if you have a child who's under 3, make sure they have a pediatrician so they can get that. Because I'm pro-vaccination, and I want people to have all the preventative care that they need. So, but basically all ages, if you need a consult. Go ahead.
Are you just vegan, or are you whole food plant-based?
So I am vegan and I'm whole food plant-based. I don't consume animal products, and I recommend that the whole food plant-based diet with no or little to no oil, low in salt and sugar as well, SOS, is the 100% best approved diet that there is. So that's what I recommend to my patients. But I'm vegan primary care, but I also accept patients who are not. Just like if someone was smoking, they could still come and be seen by the doctor, and you would recommend, hey, you should avoid smoking because it's bad for your health or something like that. So let's go ahead and start. The topic of my talk today, thank you, Mike, for getting it up, is vegans. Still sick. What do I do now? So we all know that the vegan diet can prevent and reverse major illnesses, chronic disease. So it's been proven. And one of my favorite studies here is the Adventist health study that has been reviewed and used over and over again. And in evidence, whenever you see a dose-dependent relationship, where the more of an experiment, the more you do, the bigger effect it has, you can feel pretty strongly about the evidence because it seems to have a very strong cause and effect. And so, when over 8,000 Adventists were studied, the non-vegans, the semi-vegans, pescatarians, lacto, the farther you get into the vegan diet, the healthier they got. They were lighter. They had less diabetes and less blood pressure. The vegan group had 4 times less prevalence of blood pressure and 5 times less prevalence of diabetes. So that was prevention, and this is treatment. So, who here has seen this picture before? Yeah. So this is like the biggest promise of the vegan diet, whole food plant-based diet, is that you could even reverse our number one killer, which is coronary artery disease, which causes heart attacks and strokes, vascular disease. And so over time, there was where they reduced and reversed their coronary artery disease. So when you hear these kind of things, you're like, my gosh, I'm on the vegan diet. It's like, here's an example. Richard Hubbard lost 150 pounds on a whole food plant-based diet. He's with Healthy Living Connecticut. And here we have our very own, Tampa Bay's very own Fabricio Zebrano. He's Fab the Vegan. You'll be hearing more from him today. So we're very lucky to have him talk. 100-pound weight loss, this is very impressive. And so I joke around, like when I'm ill or when I'm sick, what? I'm vegan. How am I getting sick? This is supposed to be all, unicorns and rainbows here. I'm supposed to, be immune to all disease. And it's kind of like, who here has seen Nailed It or Failed It? Have you ever seen this? This is a movie, a show on Netflix. It's one of my kids' favorites. It's a baking show. And what they do is they say, okay, this is what you have to make, this cake right here. And then they give them like an hour to do it, or something. So they really, jumping around and trying to get it. And this is what the end product looks like. So the concept is that sometimes even when you know the right thing, reality gets involved. Real life gets involved, and sometimes you don't get the result that you were looking for. So I'm not trying to scare you away from the vegan diet. I'm trying to just give you a dose of reality. There's a timeline for healing. You can get benefit right one day if you eat a low-fat plant-based diet, a whole food. You're going to basically cure yourself from heartburn, unless you have really bad ulcers, which may take time to heal. In 3 days, the constipation is basically cured too. It takes a couple of days. Weight loss, you see it at about 7 days. And then after about 6 weeks, your markers of inflammation are dramatically improved. You start to have, less joint pain if your joints are inflamed, and inflammatory acne lesions are dramatically improved. But, the big ones in terms of mortality, blood pressure, high cholesterol, diabetes, stuff like that, sometimes that takes longer. Sometimes, if you have dramatic damage in your vasculature, it's going to take a longer time to, get them cleared up. So we're not going to talk a long time. We're just going to go over a couple of ones. We're going to go over weight, cholesterol, and just a couple of these. What do you do if you've hit a plateau, you're trying to lose weight, you're on a vegan diet? What do you do now? Well, obviously the first thing you do is you switch off all animal products. And that may seem, but if you have room, this is the first thing you do. Like, eliminate, don't just do it 5 days a week, just do it 7 days a week. And then the next step is oil. We talk about the whole food plant-based diet, salt and oil and sugar-free. Oil is liquid fat, and it's been touted as a health food in the past. But we all know that this is an empty calorie. Just like we think of sugar and Coke, in the past we think of that as an empty calorie. Now oil has to be in that same kind of category in your mind. And so this is one of the biggest problems. You go to a restaurant and you order veggie fajitas and it's loaded with oil or something, and then it's very, very calorie dense. The next step is caution foods. Who here has heard about Dr. McDougall? Okay, have you seen Dr. McDougall's Handbook of Food Poisoning? Have you heard that? He has this cool talk, but it's basically the traffic light diet. And he gives you everything is green light, green light, green light, green light. And it'll say, oh, yellow light, and then animal products are red lights. Trans fats are red lights. But the yellow lights are some of the things like nuts, avocados, dried fruit, some of these high, smoothies where you can get a lot of calories in really fast. So you just got to be kind of careful. These are the yellow light foods. These are caution foods. They're rich. So if you're trying to lose weight, you want to limit those dramatically. You want to limit those and treat them as the treat that they are. They're high in calorie. Treat them as a treat. The last one is salt. Salt it's evil, kind of. It's evil. It's a drug-like substance. If you had a pile of cocaine, or you had a pile of salt right next to each other, I don't know. I haven't seen cocaine, but I don't know if I can tell. In the movies, that's what it looks like. So the concept is it's drug-like. When the salty food goes into your mouth, you're on fire. You're under the spell of the salt. I know if I eat a potato chip, the second potato chip is going into my mouth even before I think about it. So I do have a little tip for when you're under the influence of salt, and that is to stop, drop, and roll. You're on fire. You're on fire. You stop, drop, and roll. You got to stop the chips. Put them down. You got to stop, you got to drop them, and you got to roll. You got to step away. And then you got to remember and reflect. Oh, man, I just ate like a whole bag of potato chips. Didn't realize it, And so remember that it has that effect on you. Stop, drop, and roll. Okay, cholesterol. A lot of my patients been vegan for a long time, yet they still have high cholesterol. What gives? I mean, cholesterol comes from our diet, but it mostly comes from our body makes cholesterol. Cholesterol is like the building block for our cells and for our hormones, and so our body makes, in omnivores, our body makes 80% of the cholesterol that we get, and so in vegans, the body makes pretty much 100%. So what gives? Well, we know there's some is genetic, and it can be high. But if it's genetic and it's high in you, I still recommend trying to do things to bring it down, because we know that cholesterol is an independent risk factor for heart disease and this sort of thing. So, what do? We don't eat animal products. We're not getting cholesterol in from some other source, but they're saturated fat. The tropical fats are the fats that the vegans get. Those are palm oil and coconut oil and cocoa butter. And these are saturated fats. And that's why, you might have heard how coconut's actually not really a health food. Coconut oil is at least not a health food. It's high in saturated fat. So what does saturated fat do? Saturated fat is bad for lots of reasons, about insulin resistance and all sorts of things. But for cholesterol, what it does is the liver's job is to catch the cholesterol floating by and to use it and turn it into another chemical. So the body uses as cholesterol resources and turns it into different things that it needs. But when you have saturated fat in your diet, it stops those receptors on the liver. So it stops the amount of reuptake in the liver, so you got more cholesterol floating in your blood. So I think about it like Velcro, that the liver is like Velcro waiting for something to come stick to it. But when you eat saturated fat, it kind of gums up the Velcro for that. So, decreased saturated fat, that's something you can work on. The next two are plant sterols and fibers. So, when we eat cholesterol, we have to absorb it. And these are things that kind of block it inside our intestines. But also, these plant sterols are cholesterol-shaped chemicals. And when our body absorbs these plant sterols, it reduces our overall cholesterol in our body. So, even though we're not taking any cholesterol, the plant sterols work to reduce it. And plant fibers... Who here eats flax seeds? Flaxseed's good. Flaxseed is amazing. It's a superfood. And that viscous water-soluble fiber, that also helps to reduce the fat absorption in our gut. So I know this is kind of gross, and I'm not selling veganism, but when you eat high viscous, your bowel movements have a little bit more. Your bowel movements tend to be a little looser, and there tends to be a little bit more fat inside the feces. So I know that sounds kind of gross, but you can actually see that, okay, I'm absorbing less of these fats, and you can see how the bowel movements change. Okay, last one. We're going to talk briefly about blood pressure. Who here growing up was told, hey, you gotta eat a high protein diet. We need protein. If we're going to get big, we're going to get tough, and we don't have enough, we're going to die or something. I don't know. But even though all of us joke around right now, it might still be in the back of our mind. We're kind of like the Terminator when we get a food in front of us and we're like, we're scanning for the protein, right? It's hard to get that out of our system. When I really like the concept that when you're an infant, you get only 6% of your calories from protein. So, I mean, at that time, you're like doubling in size, and that would be the time where you would need protein the most. So certainly we don't need as much protein as we're getting. The kidney has to deal with the protein that we give our body, and if we're flooding our body with proteins, even when they're plant-based, sometimes it can be kind of rough. And so a lot of my vegan bodybuilders who, or folks that are into a lot of like sort of the rich, fake meats and cheeses, and they eat that a lot, that has a lot of protein, and the body has to deal with it, and it can drive up their blood pressure. And so that's something that I like to focus on. Hey, are you taking protein supplements? Even if it's pea powder, you're going to want to reduce that because there's no need. The next thing is salt. The kidney has a harder time regulating your fluid if you have a high salt intake, because it's harder to squeeze out the urine in a salty environment, because where salt goes, water goes. The body will retain. You get bloated. You can feel it in your joints. You can feel it in your hands when you eat a salty meal or a meal with a lot of like soy sauce and stuff like that. Last one is fruits and vegetables. This one's a little bit more confusing. Why do fruits and vegetables make my blood pressure better? Well, there's the potassium and magnesium and the things in the fruit, but I mean, just in terms of some people kind of have a constricted diet and they don't like to eat a lot of things, they get used to certain things, but it's important to increase your fruit and vegetable. Populations that eat the most fruits and vegetables have the lowest blood pressure, so we know that they're good. There's a particular vegetable that's important for if you have blood pressure, and those are the nitrate-rich vegetables. The nitrate-rich vegetables, the number one top dog is arugula. It has like 450 milligrams per 100 grams. So, but there's also beet greens and other greens and lettuce, believe it or not, like butterball lettuce, butterleaf lettuce, mixed greens, mixed mescaline. So these things have nitrate-rich compounds that in your vessels, they dilate, they turn into nitric oxide and dilate your blood vessels and make it easier for your heart to push. And so you need to, if you have high blood pressure, that's one thing that you want to do. Also, who's ever heard of some tea, some special tea you can take for blood pressure? Anybody? Hibiscus, yes, hibiscus is one. Flaxseed is also another one that you can do. Okay. We're starting to wind up. Basically, you got to believe in yourself. You can do this. If you're having medical problems, go on the vegan diet. It's the best thing that you can do for your health. If you still need a doctor, you still need some guidance, I can give you some encouragement. You can talk to me. I'm here for you. You can do it. Some folks have been reluctant because, I don't have an office presence of 100% telemedicine. But Blue Cross Blue Shield has kind of pushed me into this because they're not going to offer me I'm not going to be accepted until I have a brick and mortar. We've succumbed to that, and we're going to do it. We're going to get a brick and mortar. We've got an office in Pinellas Park. We're going to be doing it 1 to 2 days a week starting May. And so if you have a work form you need filled out with an exam, or you have children that need a school physical or something like that, we'll be able to do all that from an in-office visit. So that's my brief talk today, and I just want to thank you guys for your attention. I want to thank Shannon Blair for setting this up for me. Thank you so much. Anybody have any questions?
Questions? I can bring you the mic.
How did you know the benefits of a plant-based diet as a doctor? Because usually doctors don't know.
Doctors don't know. I mean, basically, doctors will kind of parrot their parents' information to their patients about nutrition because they don't get a lot of nutrition talk, and that's one of the reasons why Dr. Clapper is one of my heroes. He has taken upon himself to go around to the different colleges, the medical schools, and send the message. The evidence has been out there for a long time. So my vegan hero story, my vegan hero transition was when in the military, I'm still in the military, I have to run. And with the standard American diet, I started to gain 1 or 2 pounds a year, and my running was harder to do. And I tried to lose weight, and I told all my patients to lose weight, but I failed. I failed miserably because when you eat an unhealthy diet, you can't eat it's hard to eat small enough portions of an unhealthy diet to lose weight without being completely miserable. So I was ready, I was primed to hear the message, and that's when I saw Forks Over Knives, and that's when it all fell into place. Seeing Dr. Furman and Forks Over Knives just take people off their medicines one by one after another, it was so inspirational. Now I know there's hope, even if you have most medical problems, that there's hope for a cure, where as a family doctor prescribing pills left and right, it starts to feel hopeless, like you're a drug dealer or something, So this is the way, and I'm here to shepherd it through for people whenever they need. Go ahead, sir.
So I find that a lot of people look for vegan doctors and they have a difficult time finding them. Is there an easy way to do that?
aPlantBasedDiet.org, and there's different sites.
Okay.
aPlantBasedDiet.org is a site that curates. People put it on the map where they're located.
Oh, perfect.
There's other PCRM. PCRM is a Physicians Committee for Responsible Medicine. A big Dr. Barnard, big vegan. He has a vegan doctor finder service. It's another list type service. Yeah. Sir?
Yeah, I've been a vegan almost 2 years now.
Okay.
And During that time, I've lost 40 pounds.
Impressive.
But one of the biggest things that I had to teach myself was, it may say vegan on the package, it's sugar. It's got sugar in it. And that's one thing I've really had to train myself, because I was eating tons of, and I got my A1C down to 6 points right now.
That's great. That's great.
And I want to keep it going down. I want to get down to 5.7 or under.
Absolutely.
But even it says vegan on it, still read the package. Make sure, because there's sugar in it. And that is the white devil to me, because it will kill me. So that's all I have to say. Thank you.
Yes. This nice lady here has a question.
Thank you. What are your thoughts on triglycerides? I noticed you said fruits are good for lowering cholesterol, but like Google says there's a certain percentage of the population where it can actually increase triglycerides.
Triglycerides and free sugars are a concern, and a lot of times when people first start, my experience is that as their cholesterol is coming down and as their weight is coming off, it seems like triglycerides are up a little bit, and triglycerides are bad when they're in the high, over 500, or very scary, over 1,000. People can have pancreatitis and things like that. If they're under 500, there can be a little bit less worry about them. The big one is the LDL cholesterol. It has the most atherogenic aspect. So sugars are implicated in raising your triglycerides. And the kind of the party line amongst the sort of vegan royalty is to improve your whole grain consumption and decrease the sugar, just the free sugars like smoothies and colas and sugars like that. And so if you're not really consuming these, just plain up sweets or free sugars and juicing through juices, and do that first, recheck your triglycerides and see if if you're not in a state where you're like actively losing weight, you're sort of stable and you're still having high triglycerides, then you really want to focus on sugar. But I think that the triglycerides can get you kind of like spun up when the main focus should be on the LDL cholesterol, because we know that's the most atherogenic. My son has a question.
What do you think about like simple carbohydrates and things like that?
Okay, yeah, simple carbohydrates and sugars. One of the things that like juices and as we were talking just now, the juices and smoothies and things like that. If you have a choice between a smoothie, which has been ground up, versus a juice, choose the smoothie because it has the fiber component. If you have the choice of a juice versus a sugars, high fructose sweetened beverage, choose the juice. In nutrition, everything is relative. You can't say, well, candy is bad for you versus what, chocolate versus candy, or, everything is, you're comparing different things, because everything you eat is something else that you're not eating. What did you not eat? Did you not eat the kale, or so it's all relative. Yes, ma'am.
Yes. Esselstein has his Prevent and Reverse Heart Disease book, and I have a friend who basically said, yes, that's okay when you're at the beginning of your heart disease, but once the cholesterol has calcified in the arteries and veins, diet will not take that back. I mean, we'll have a lot of benefits from it, but the vegan diet will not undo the calcification in the arteries. What's your take on that?
That seems reasonable. Hey, I've got these arteries that are totally clogged. Is there any hope for me? And the answer is, there's hope. Don't give up hope. Don't stop trying. The body is amazing. I mean, you can have a huge wound on your arm, and the body remodels it like magic. I mean, there's millions and billions of little immune cells working their magic, and so you can cause great tissue changes on a huge major wound. You can cause great tissue changes in the vessels. So don't ever give hope up hope. It's never too late. If you're 80 years old, if you're 90 years old, Don't give up. Don't give up, because it's all about improving the time that we have on this earth. You want to be vital, you want to have energy, and you want to have low disability. You want to be active, and it's the only thing that we really can control in our life is the food. So you want to do as best you can. Don't give up hope. Yep. We might
Anybody
be
else?
that might be a okay. Yes, sir.
I noticed that a lot of bodybuilders eat a lot of raw eggs. Why do they do that? Is it because of the protein, or?
Eggs have had this marketing about being the perfect food, and maybe they do the egg whites because there's too much cholesterol in the egg yolk. But we know that animal-based protein increases your IGF-1, insulin-like growth factor 1, which is a cancer-promoting thing. So you definitely want to avoid eggs. When they've studied eggs is one of the when they studied in populations, populations that eat the most eggs had higher risk for cancer. So yes, it may be sort of a holdover from the past, and maybe bodybuilders are doing this because it's natural proteins and things like this, but there's no, you don't have to worry about your body getting complete proteins with plants. The body's amazing. If we had to eat this and eat that and, have to mix these special things, we'd all be dead, because we can't, we're humans and we're fallible, and our ancestors are not mixing corn with this or that. You don't have to worry about the perfect protein or complete protein myth. That's nonsense. The body does it for you. You don't have to worry about it. We may have time for one more question, I think. Last one. I'm so sorry for taking time.
Dr. Harrington, if you were diagnosed with cancer today, would you do radiation and chemo? I read that 90% of oncologists would not.
Okay, well, I honestly, I'm not an oncologist, and that is a very specific question. But I will say that a lot of my patients, being vegan, we are kind of skeptical about the sort of the medical establishment. And the medical establishment seems to be pushed by pharmaceuticals, and they're driving the train. Get somebody on a medicine that they have to take for the rest of your life. Boy, you're making some money there. So, but I don't know about the specific therapy. If I like life, and I'm going to try to fight as much as I can. I think that I wouldn't say that I wouldn't accept chemotherapy and everything, but it's always a talk. That's why it's nice to have the doctor-patient relationship's important. My father-in-law died of cancer, and when our relationship with the oncologist was horrible. They didn't tell. There's a paternalistic society. It's paternalism in medicine. It still persists, and that's where the doctor knows best. And so my job is to try to provide you with an understanding of to try to translate medical knowledge so it's easy to understand, and then you can make your own decision about the side effects and stuff, sort of thing. Sir, I think we're trying to maybe wrap it up. I don't want to. I want to be a good steward. We can talk it, and I can come back and talk with you.
But this is general.
What's that?
He said it's general.
This is general. In response to what you just told.
It's okay.
Yeah.
This is in response to what's just been asked.
Yes.
I had cancer back in 2013, stomach cancer. They took away 80% of my stomach. Then they gave me chemotherapy, which just about killed me. We had to abandon it. My wife did tons of research. Ever since then, we've been on plant-based. I've never felt better.
All right.
Every 2 years, I go back, do an endoscopy, make sure nothing's happening. No problem.
That's wonderful. That is.
With chemotherapy to kill you.
The plant-based diet. You want to be you want to give yourself the best chance. And there's lots of stories where people are healing themselves. The body has a natural, inherent healing ability to heal itself. Thank you for sharing that. It's helpful to hear. Please, if you need to talk to me, reach out to me, and I'll be here for you. I thank you for your participation, you guys.
Everybody, a big hand for Dr.